The pandemic has pushed preventative cancer screenings back across the board.
Bryan Health's gastroenterology department saw a nearly 80% decrease in people coming in to get screened for colon cancer at the beginning of the pandemic. 10:11 Now's Madison Pitch has more on what that might mean for cancer in the future.
While the screening numbers are trending back toward normal, doctors are worried there are people whose cancer was missed. The latest data from the American Cancer Society shows about 5% of men and 4% of women will develop colorectal cancer, a cancer that is largely preventable through regular screenings starting at the age of 45. Al has worked for UPS for over 30 years, and right before the holidays in 2013, Al was not feeling good.
I have a coworker who said he could swoop by Seward and grab an extra 20 stops, and I talked him into 30, which really made me feel embarrassed. I don't ever ask for help.
Al and his wife ended up in an emergency room at Bryan. His doctor said he was surprised Al was able to work at all that day. The diagnosis, stage 2 colon cancer.
The whole thing was very unnerving, but the roughest part was finding out, believe it or not, that I was going to miss a minimum of 2 weeks of work during the busiest time.
He was just 6 months past 50. He had planned on getting a colonoscopy.
I was going to do it. I just don't know when. The sad part was that we had lost a good friend 2 years earlier, and I was dragging my feet at a procedure that will save my life.
Doctors say putting off cancer screenings can be deadly.
The best time to get screened is when you're not having symptoms.
In an average year, Bryan Health sees between 700 to 800 people a month for colonoscopies. Last year, right at the onset of the pandemic, they say they were down to around 150 to 200 people.
We see approximately 150,000 cases of colorectal cancer a year. We expect that number may rise just because over the last year, there's been a drop nationwide in the amount of screenings that happen.
Al knows it could have been a much different story, and he wants you to know. Don't wait to get screened like he did, because even months can make a world of difference.
I'm really getting to sit, stop, and smell the roses and spend maybe quality time with my family. The colonoscopy can save your life.
Al says since his diagnosis, he's worked to make sure others go in and get regular cancer screenings. To date, he says he's had about 40 people reach out to him to thank him for encouraging them to get tested.